Hi, my name is Dr. Shree Datta, and I'm a consultant obstetrician and gynaecologist practicing in London. I'm delighted to be speaking to you about an incredibly common subject in women's health, and that is one of infertility. Now, when I say common, I would say approximately 1 in 7 couples present with infertility. And by that, we mean those who have been trying for over a year, 2 years, potentially even 3 years without success. So what type of factors actually cause infertility? Well, if you look at the different groups and types of infertility, of course, could be female factors, could be male factors, and they're roughly about a third each. And the final third is actually unexplained infertility. So it's really important that we take a very thorough history to find out your medical background, both for you and your partner. And the types of things that we will discuss range from whether you have a regular menstrual cycle, right through to any medical problems, medications, any alcohol that you drink. All of those different factors may well come into play. And similarly, we'll do the same for your partner. And we'll more specifically also look at whether you've ever been pregnant, any outcomes of those pregnancies as well. Then we'll also look at any relevant investigations. So that's often blood hormone tests or in fact ultrasound scans to see whether there is an obvious factor that is contributing to why you are experiencing infertility. And that can be done in most of the clinics, in gynecology, women's health, or in specialist IVF units. And it's at that point, marrying up your individual results and of course your partner's results, that we'll think about a management plan. But before we go down the invasive IVF route, is there actually anything that you can do to really optimize your health and potentially even your partner's health? Well, actually, it's worth thinking about your lifestyle, your diet, and the supplements that you're taking. So let's break each of those down one by one. And so the old adage of eating well is incredibly important when it comes to maintaining and optimizing egg health. So what do we actually mean by that? Not just eating regularly, but also looking at what you're eating to maintain and optimize egg health is really important. And all of the key factors we are told time and time again when it comes to good nutrition come into play. So making sure you have a balanced diet with a high amount of protein and looking at the types of food that you are eating, be it semi-skimmed cow's milk right through to almond milk, and the amount of protein, the type of protein, organic or non-organic, all can make a difference. All right. So that's one key factor. And added to that, the type of supplements that you may be taking can also contribute to egg health. And that can range from something as simple as your everyday multivitamin right through to specialist supplements to help regulate your periods further if that's an issue, or indeed to strengthen egg health. So for example, CoQ10, which is a very common factor that women often add in when it comes to supplementation to optimize egg health. So these are all factors to look into. Now, I also mentioned lifestyle. What exactly do I mean by that? Sleeping well, having a regular routine so that your body clock is regulated is incredibly important. And that can also help make sure that you maintain a regular menstrual cycle and you are having a higher chance of releasing a good quality egg every month, right? That's the first factor to take into consideration. But things like lifestyle stress, long working hours, travel can all affect when you ovulate, and of course how regular your menstrual cycle is. So those are all factors to consider. Now, there is one further factor, and that is the types of things you come into contact with. So believe it or not, plastic containers, the types of deodorant, the types of pan you cook in, store your food, even nail varnish can contribute in very small amounts to your egg health. So again, looking at what you're using and optimizing those is incredibly important. Now, we've talked about sleep, we talked about lifestyle and diet, we talked about supplement. There is one final thing, and that is, of course, exercise. And that can help just clear the mind and also make sure that you are fit and healthy in yourself. And extrapolating from that, if you are overweight or underweight, maintaining a healthy BMI can actually contribute to making sure you've got a regular period cycle and therefore are releasing that all important egg. Something really basic, not to forget, is to have regular unprotected sexual intercourse, not just timed in the middle of your cycle, but actually leading up to potential ovulation and beyond, to make sure that you maximize any potential chance of fertilization of a healthy egg. All right, so that sounds really basic, but that is a key factor. I spoke about supplements. Please make sure that you are taking them 3 months in advance of trying to get pregnant. And that's so that in the lead up to getting pregnant, the eggs that are being released are of optimal quality. So just something to think about. There is one final factor. We talked about exercise, regular exercise, and we talked about sleep, but maintaining all of these in conjunction with each other, in sync with each other, is incredibly important. Your mental health is one final factor to consider when you're trying to conceive, because it can be quite difficult when you're seeing monthly periods and negative pregnancy tests. So making sure you have good support around you, be it family, friends, or even a counsellor, can be incredibly helpful during what can be a very stressful period. So, in conclusion, we've talked about the different types of infertility that you can experience. We've touched on the tests that can be done. And most importantly, we've considered the different basic factors that you can consider and address in detail before considering medication and invasive treatments. So I hope that's been helpful, and I look forward to discussing something further with you.